So just to warn you all, you are unmuted, so if you do say anything, it will be used in evidence against you later, so it's on the recording, so please be careful. If it gets too loud in the background, we might have to mute everybody because it does sometimes get a bit difficult to talk over everybody else if there's a lot of noise in the background. So if you're sharing a computer, if there's 3 or 4 of you around a computer, I might have to mute everybody else. Okay, but we'll see how it goes. So the agenda, you can see in front of you, we've got the list of items. We've got the review before invitations, and that includes the residential institutes, and there's separate articles for some of these bits and pieces. We're going to cover the ordering. Hopefully that's already been done because we're well into the start of the flu season already. So these should have been ordered way back at the start of the year, but I know there's still some ordering going on for the child vaccines, which started this week. Then we've got the invitations, so we can show you the reports that we've got for those. We'll talk about patient-specific directives and how best to do those. Recording vaccinations, that's always a tricky one every year with practices deciding that they want to recode everything as well as recording vaccinations, but we'll talk about that in a minute. And then what you can do after the clinics to tidy up the data if the reports, the numbers look a bit low to what you thought they were going to be. And that comes on to the payment reconciliation as well. So we've got reports that compare the numbers, so you can look at those numbers and compare them to CQRS to make sure that you're going to get paid for everything that you do. And we can talk about what you can do if those numbers don't match. And at the end, we can have any questions, but all the way through, if you've got any questions, there's a speech bubble at the top, and you can post a question, and we'll try and pick them up as we go through. Otherwise, we'll pick them up at the end. And like I said, we are recording this webinar, so if your connection drops out at any point or you need to leave, we can post this later on and you can catch up later on. So, reviews before invitations. If I just drop down the agenda and go into System 1. If I go to reporting and clinical reporting, you should know the top level folder is called Ardens Limited, and then further down the bottom there's a folder for vaccinations, and in that folder we've got all the seasonal flu report folders in there. So the reviews before, we've got lots of folders, lots of reports that you can check the quality of the data. So we've got ones for age 18 and are on aspirin. Apparently there's some sort of contraindication if you're taking aspirin and you're under 18, and you should be offered a particular vaccine for those. So that's something to be aware of that we weren't aware of last year. This is something that our clinical pharmacists made us aware of this year. And you can see for this practice I'm logged into, we've got 5 patients that does affect. So they would need to be reviewed by the GP to make sure that it's okay and appropriate. We've got care home patients. So care home patients are quite tricky. Residential patients, we at Ardens can't create reports to look for your local residential codes. So we have to look for recodes instead. So that's why we ask practices to recode their patients who have moved into a care home. It seems a bit daft that you have to duplicate by adding a residential institute code as well as a recode, but that's the only way that we can report on those patients. And there is an article that tells you how to tidy that piece of work up before you start doing invitations. And lots of patients go into a care home and then they come out again. They go in for respite, and the codes don't get removed, or they don't get coded. It's no longer in a care home, and then the list starts getting a bit messy. So it's definitely a list worth looking at, just to check you've got the right patients. And then we've got carers. So you need to make sure that all your carers are coded correctly. I know there's a lot of work nationally to try and identify carers and make sure that they're looked after, given health checks and all the rest of it. And one of the things they're entitled to is a flu vaccination every year. So we need to make sure that they are coded in the first place. Previous years, the CQRS reports, the TPP reports, haven't always picked up carers. So we have, in previous years, asked practices to code those patients with 90X4 if they're still a carer, which then makes them eligible for the vaccine and for payments. We've not seen anything this year to indicate that you have to do that, but it's just there as a precaution, really. And then we've got housebound patients. These are always tricky patients. Quite a moving list of patients. So you make sure that your GPs are recording correctly for housebound patients, and these are pretty much always done by community care teams, district nurses, but you need to make sure you've got your list up to date. And then we've got a report for allergies and contraindications. So there are some allergies and contraindications that are only valid for a year, and others are persistent. So again, you need to go through this list to make sure that those allergies and contraindications are still relevant for this year before you start inviting them, because you might find that actually whatever the problem was at the time last year has now resolved itself, and they're no longer allergic or contraindication or whatever. So those need to be marked in error or changed in some way by the GP before you start doing your invites. And then you've got the pregnant ladies. We have a number of emails and phone calls about pregnant ladies each year, and this year is no different. It's quite difficult to keep on top of this list, we know. But the thing is to make sure that you're recoding the actual outcome of the delivery or miscarriage or abortive outcome to keep that list as up to date as possible, because the last thing we want to do is for practices to be able to invite patients who they think are pregnant, and actually the patient then phones up and says, why are you sending me a letter? I had a miscarriage 2 weeks ago or 4 weeks ago or whatever. So it's really important that that list is kept up to date and reviewed before you start doing your invites. And then we've got a list of given by any other provider last year. So again, this year, pharmacies and other organisations can give the flu jabs, and they can claim the same money as practices can. So it's a bit of a battle out there to try and get the patients in first and get the money. And this list is patients who were vaccinated by other organisations in previous years that you might want to contact this year to say, look, we know you had your vaccination done at the local pharmacy last year. How about coming into the practice this year to have it done? So it's just another tidy-up report, really. And then we've got an SMS report. So there are patients who give you their mobile number. They then tell you, yes, I consent to SMS. And then for some reason, the mobile number gets removed from the record, or the number doesn't get on the record in the first place, but they've recorded that they give you consent to SMS. So again, this is just a tidy-up report to identify patients who have been coded with an SMS consent but don't have a mobile number recorded. So again, it's just another time saver and cost saving for when you start sending out SMSs if you use SMS to invite patients. And the bottom one is for the 90X4 code, the code that makes patients eligible if they don't fit into any other risk group. So these are patients who were previously coded with this last year before this flu season, who would have perhaps had the flu vaccination last year because of that code on their record. And really, the GPs or a nurse should really go through those to check that it's still relevant for this year. And if it is, then that code needs to be reapplied after the 1st of September, and then it will get picked up by CQRS and all the payment reports and everything else. There's a number of patients who always come through who are not coded with 90X4, but they had it last year. The doctor says they need it again this year. The receptionist will book them in, but unless they're coded, then you can't claim for those payments. So that's all the review before. So then we move on to the ordering. So hopefully, like I said, all the ordering's been done already. But we have got some reports that we've had in place for quite a while, which identify the different groups. And I know that practices are now going through the process of ordering the vaccines for the children as well through the IMSForm website from this week, I think it was. So they are still relevant. So we've done our reviews, we've ordered our vaccines, we're now moving on to invitations. I presume most of the practices would have probably sent out some invitations already. But again, if we go back to the list of folders, under the vaccination folder, there's another folder underneath there for invitations. And when you first look at this list, it does look quite confusing. There's an awful lot of reports in here, but it's actually quite logical the way it's been broken down. So the first ones at the top there are broken down by age groups again, and then it moves on to the actual invitations. So if we look at the first invitations, for example, you can see the first group is age 18 plus, and we've broken it down by email, SMS, and post. And we've even put in a report there for MJOG, for practices who use MJOG as well. And you might think, what's the difference between SMS and MJOG? And I'm just going to mute background noise there, someone taking a call. So the difference between the SMS and the SMS MJOG is the SMS MJOG will look for any patient with a mobile number, whereas the SMS one will be ones who have consented to SMS. MJOG works a little bit differently, and practices might adopt the role that they want to send out an SMS because a patient has given them their mobile number. They consent by default, and that's how some practices use it. So you see the numbers are very different. We've got 376 with SMS consent and double that who have a mobile number. So there's always lots of patients who haven't given consent, but some practices assume consent, which is up to them. So moving on then, we've got 18 to 65. Again, it's broken down in the same way. And then 65 and over, again, broken down. And then moving further down, you've got the reports for the school-age children and under 18s. Some of these, the 4 to 10-year-olds, I think it is this year, are being done in schools. But our understanding is that you can still vaccinate those if they're in an at-risk group and their parents decide that they want their child to be vaccinated in the practice instead. Although we have heard some reports that in some areas that they've been told they're not allowed to do that. And then just below that, there's another couple of reports there for cough patients. So we've broken out the cough patients specifically by age group 18 to 65 and 65 and over. So once you've run your reports, you can easily send an email or an SMS or a letter from these reports. You don't have to do anything much else really, as long as you've got your letters in place if you're going to send letters. So I can right-click on this and I can go to Actions. And on the Actions menu, I can I can send a letter, I can send an email, or I can send an SMS straight from that list there. I can't show any more detail than that because this is a live system, so we'd be showing live patients, but that's as far as I can go. So it's very easy to send it from that list. But what you do need to remember to do is, once you've done that, is to add the read code that we put in brackets at the end of the reports. So the XAZZB in this case, and that will then code that the patient has had an email invitation, first invitation. Once they've been coded with that, they'll then move on to the second invitation report. You won't see them in the second invitation report for 2 weeks. They drop off the first, they'll disappear completely, and then in 2 weeks' time, they'll pop up on the second invitation reports. So we often get asked, just sent my list of patients an invite, and now I can't find them. And that's the reason why the reports are built to only show you when it's relevant to send that invite. So 2 weeks is quite short, really. But in 2 weeks' time, that patient would then show on the second invite, and so on to the third. So first, then we've got the second invite, same format again, and then the third invite's exactly the same format again. So that's the invitations. So if we go back to the agenda, so moving on to patient-specific directives, PSDs. This is something that has come up quite a lot this year, more so than last year. I'm not quite sure why, but there's lots of practices asking what's the best way to record PSDs? Can we bulk record them? How do we do it? So we in Ardens don't recommend that you bulk record PSDs because, strictly speaking, you should actually check all the records. So a clinician should review the record first and then record the PSD. Otherwise, it's kind of pointless. Really, you can bulk record them from a report or from an appointment screen, but it needs to be done by a clinician, and they need to review the records as well at the same time. And we do have electronic PSTs on the template, which I can show you in a minute. So we can have a look at that in a minute. So we'll move on to recording vaccinations, and I'll open up the template and I can show you that right now. So I'm in a test patients, and if I just click on the demographics to go back to the home screen, you should see in your eligible patients, you should see on the patient's home screen, you should see a patient status alert that says consider influenza vaccination, and then it will be different for each age group, and then there's an action link which takes you through to the templates, but also underneath the demographics you'll see the symbol there as well, and if there's no symbol, if I just flick to another test patient, see we've got no symbol here at all, and if you need to vaccinate this patient or code them in some way, you can't get to the template through there, but if you go to auto consultations and go down to Arden's IMS and injections, and then up to influenza, you can get to the template that way as well. So if we just cancel that, go back to the other test patients, and if we click on the action link, it takes you to the template. The template has just today been updated. It's been refreshed, and we think it's much better than it was before. It's been broken out, so they've got 4 tabs now. So the first tab is for the immunization itself. The second tab is for screening. You can see we've got things like AF screening, pulse rhythm, pulse rate, smoking, all those other bits and pieces on there. And then there's a resources tab, which has links to various leaflets that you can copy and paste into an email or an SMS to the patient. You can tick to say you've given a leaflet to the patient. And then the final tab is a view which will show you any allergies, adverse reactions, previous vaccinations, and any previous declines for vaccines as well. So we think this is much cleaner than the previous template, but please, if you've got any comments, do feed them back through to us. But the actual main immunization tab hasn't changed too much. Hopefully it looks quite familiar. So we were just talking about PSDs. So we can see in the middle there's electronic PSD authorization. So your clinicians can click on the preset text, the preset notes, and it brings up preset text that they can just double click and it drops it straight in. So it's quite quick and easy to do. If you need to print a PSD, you can click on the PSD form, print that off, get it signed up, and then unfortunately in that case it needs to be scanned back in, so it's a time-consuming way of doing things, but I know some practices do still do that. So that's the PSDs. So if we just cover the template, so coming into the template, you've got the top item there, advice given, so that we can tick that. And then there's a button there to say, why is this patient eligible? Previous years, we haven't had this. This came in last year, I think, for the first time, where a lot of practices were asking, this patient has a eligibility status on their home screen. We're not sure why. Can you tell us why? So we put this in place so you can click on here and it tells you actually this test patient is in the diabetes risk group. It doesn't tell you specific codes, but it tells you which risk group that they're in. And there's a link there to the Green Book if you need to refer to that. Consent given by the patient or for a child. And then we've got consent forms. So the consent form for an adult, we can have a look at that. Just wait for that to open. And there we go. So we've got a consent form with the sort of usual standard questions, which can be saved back to the patient record. Similar for the child, obviously it's the parent giving consent. And then there's a given in best interest tick box as well, if somebody doesn't have capacity to consent themselves. There's a fit for immunizations, so you can type in there whatever you need to if they're not fit. If they've got a fever or whatever the case is, you can type that in. Then there's a contraindications box with the usual contraindications. There is, to the right of that, an allergies summary view as well, so you can see if they've got any previous recorded allergies and sensitivities as well, so that's quite useful. And then you've got 2 starred items, the influenza vaccination status. So if this patient wasn't actually eligible, you could come in here and you could code them with 90X4, which would make them eligible for the vaccine and for payment as well. And the other one is to say that it's not indicated, so they could be eligible, but the GP thinks that it's not really appropriate for them to have it, so you could code that as well. And then last year we had the introduction of the Health and Social Care Workers Enhanced Service, where practices were asked to record when somebody is employed by a care home or a nursing home or whatever else, and then you can claim for those vaccinations as well. So that's another one to look at if you've got patients who that affects. Get those coded. We looked at the PSDs, but we've got PGDs on there as well. And then the next one along is vaccination templates. So one of the main questions we get asked about the template is, it's too busy, there's too many boxes, too many choices. Can we cut it right down? And the answer is unfortunately no. We have to offer every possible option to cover the whole country, basically. But what we have got is a vaccination templates button, which will take you to your local vaccination template. So you could set up a local vaccination template for your particular brand that you're using. Click on this, and then go straight through to the vaccination template that you set up for your practice. That's one way of removing the chance of a nurse or a GP picking the wrong option on the screen below. So that's an option. If not, you can see some of the boxes are greyed out. So the test patient we're in is 19-year-old. So the over 65 is greyed out, and a couple of the others are greyed out as well. So only the ones that are relevant for your patient should be live. And if for some reason that's not the case and you need to use one of the other options, there is an override vaccination choice at the bottom. So if you tick that, all of the others become active at the same time. You can choose what you want to use. So the choice is yours. But we try to direct you to what the patient should have, but it's not always correct. So then below that, you've got given by other. So we have lots of questions about vaccinations given by pharmacies. How do we record that? So we've got this box here, given by other. It opens up another window with a little bit of text to say the best way to record it is as a vaccination, but you can record it as a recode if you really want to, if that's your practice decision. But if you record it as a vaccination, it takes you through to the vaccination screen. By default, it chooses practice GMS, but it's probably not going to be that if it's done by a pharmacy, so we need to select none. Make sure everything else is correct, and then click OK. It then takes you to the event details where you can change to where the vaccine was actually given. And if you want to save a bit more time, you can create an event template as well. And again, there's support articles that tell you how to do this, where you can then choose, for example, a Boots template. If you have a local Boots that gives flu vaccines, select it from your list, apply the template, and automatically it fills out everything for you. So that's quite a time saver, really. So this is the complete way of recording a vaccine given by a pharmacy. I won't click OK on that. So if we go back to that option again, you can add a read code if you need to. There's a read code given by other healthcare provider as well, if it's by somebody else but not a pharmacist. But that's the options that you've got. We recommend that you record it as a vaccination. Oh, stop that. Okay. The other option below that is if the patient declines the vaccine this year. Again, some practices do code them, but we've got in brackets there, no code required. If you click on influenza refusal, it takes you through to the correct refusal by contents, which you can then very quickly click OK and record that in the patient record. And that's the correct way of recording. If you record a vaccination or a decline as a code and don't record it in the vaccination node as it should be, then it's kind of hidden away in the new journal, and also it doesn't show in the vaccination node where you would expect to see it. And when you do printouts for referrals, for home visits and all the rest of it, that won't come up in the vaccination list. And there is also this talk about whether when you code something and then you record a vaccination as well, when the record is transferred by GP to GP to another practice, if it's a non-System 1 practice, it could end up as being recorded as 2 vaccinations rather than 1. So there's lots of reasons. The other reason is if you record it as a vaccination, you can record the batch number, the site, and all the other bits and pieces as well that go with that, which you would lose if you just recorded it as a read code. So that's that screen of the template. The screening, I'm not really going to cover because it's pretty basic. The resources we've already mentioned. You can copy the link to a leaflet and then click on launch SMS or email, and you can paste that in and send that to the patient. So that's really useful, and tick to say you've done it. And the view will just show you we've just done that, so that's what it's showing. So that's the template. If we go back to the agenda. So we've recorded our vaccinations, we've done our clinics, and then after the clinics, you often find the reports don't quite match up with CQRS, so there's a tidy up that needs to be done. So we have a list of review after clinics reports. If we go back to reporting, clinical reporting, and then we've got this review after folder. So in here, we've got a number of reports that will hopefully help you to tidy up the data. So the first one, there's a duplicate vaccination recorded. This often, as you can see, there's one there already. This often happens where the patient is booked in more than once. For some reason, they decide they want another one, and they get booked in, they get through the system, and it's recorded that they've had one. Or it could be that they have it at a pharmacy. The pharmacy doesn't inform the practice, and then the patient decides that they want to book in with the practice as well. And then the information comes through from the pharmacy eventually, and you end up with 2 vaccines recorded in the record. They've had it twice, but you can only claim once. So you will end up claiming for those twice. If it's genuinely been given twice, then you can't really mark it in error, but you need to bear that in mind with your claims. If it's a genuine mistake, then it needs to be marked in error. The next one down then, patients get through the system who are not eligible, and you need to look at those to see whether there was a clinical reason why they had that vaccination. And if there is, then the GP or nurse can record 90X4, and then they will appear in your payments as well. Then we've got vaccination given, but recorded as a code, not as a vaccination. So again, it's up to you. It's up to the practice whether you actually look at these lists. This one in particular, because you've coded a read code, but it's up to you whether you want to go back and look at those and add those properly as a vaccination, so that it's all in the right place in the record. But it's there for you to use anyway. Vaccinations given elsewhere. We mentioned that a minute ago. So we've got given elsewhere event details and given elsewhere read codes. So again, if it's just a read code, you might want to go back to those and just review those records to make sure that they're correct. You don't want to be claiming for those if you weren't the one that actually gave those vaccinations. No response to flu invites. So patients who've had 3 invites. We're still going by 3 invites on this, but I know QOF this year have reduced down to 2 invites. But we still think 3 invites. It's entirely up to the practice. But this report will look for 3 invites. And then we've got a non-QOF decline code. So last year there was a few practices that used this XAZOI code, which is not recognised by QOF. There's a decline code, but it's not recognised by QOF. So any patients that have been coded with that can be reviewed and the correct code added, or added as a refusal, which is probably the better way to do it. And then we've got requires a second dose. So some patients, according to the Green Book, and you can see there we've got the reference there, Green Book, Chapter 19, page 11, tells you which patients require 2 doses, 4 weeks apart. And you can see, hopefully, you might have some patients in there that you need to get booked in for their second dose. And then the last one, last year we had patients who were coded with health and social care worker codes who were also coded with 90X4 as well. So they then ended up being in 2 payment lists. So this report is looking for those patients who are a health and social care worker to get you to review those records to remove the 90X4 because it's not needed, because they're eligible anyway if they've been coded as a health and social care worker. So that's those. If we go back to the agenda. So then the last bit, once you've done all that work, and it is a lot of work, is the payment reconciliation. So the first data extraction for CQRS, I believe, is coming out in about 3 or 4 days' time. And already there's reports of an issue with a couple of the CQRS reports that are not looking at the right dates. So you might find if you've looked at those reports in TPP already, that it's not picking up all your vaccinations at the moment, but we've been told that they're going to be fixed this week. So hopefully they will pick up the numbers. So if we go into TPP, and this time we need to go up the list to contracts, current financial year, CQRS, and you can see in here we've got a number of folders. We've got an annual folder, and there's quarterly folders and monthly folders. If we go to October, you can see we've got reports for all of the vaccination data extractions for CQRS. So there's 2 at the top there for the childhood seasonal flu, and that's the first dose and second dose. And then down the bottom, we've got the adult ones, so over 65s, and so on, so on. So you need to run these reports, check them when you see your data in CQRS. Just compare the numbers, and you will often find that the numbers are different. So then it's a case of trying to work out which of the patients are missing, whether your nurses are recording it correctly. There's lots of reasons why the numbers won't match. So that's the payment reconciliation. So hopefully those numbers will be quite close. I don't think they'll ever be exactly the same. There's normally a reason why, but it does take a bit of investigation to work out. And we can help with that if you're really stuck. We can have a look and see if there's something that we can work out, if there's a trend. Maybe clinicians are recording something slightly odd. And that's everything that's on the list to cover today. We've gone over just over half an hour, so we're pretty much on time. Have we got any questions? Let's have a look, see what we've got. Okay, so there's no specific questions. If you have any questions about flu or anything to do with Ardens, really, you can email us at support@ardens.org.uk. And if I just drag across from my other screen, hopefully you've all seen we have a support article for flu clinics, which takes you through everything we've just gone through. So we've got the target groups, last year's video, which will change with this year. It explains about the reports, step by step, all the different reports that we've got available, sending invitations, and so on and so on. So it's very detailed, and it tells you everything that you need to know. If today was a little bit too quick. So that's pretty much it. So if anybody's got anything before we go? No? Okay, well, we're going to sign off now, and thank you very much for joining us.